public service and brought to you today by your television provider.
We are talking now with Isabel Soto, who is Labor Market Policy Data Analyst for the American Action Forum. Good morning. Thank you for joining us. Isabel Soto, can you hear us? Lost our guest. We will try to bring her back as soon as we can and check the microphones and see what we can see if we can get a connection with Isabel Soto. We were bringing her on to talk about the impact of COVID-19 on childcare here in the United States. Our guest is with the American Action Forum. She is a labor market policy data analyst. We'll see if we can get her back and talk to her about the state of childcare here in this country, because a lot has been changing, and we'll look forward to getting your calls as well on all of this. One of the stories regarding this childcare issue has to do with a potential bailout. Elizabeth Warren and Tina Smith are two of the senators who would like to offer money for the childcare industry. Here's a little bit of detail on what the two senators would like to do. They would like emergency funding to keep childcare available to frontline and to essential workers. They would like aid to keep providers in business and to keep all workers on payroll. They would like long-term investments to prepare the child market for when Americans can get back to work. That's from Senator Elizabeth Warren and Tina Smith as well. So we hope to get our guest back and ask about this bailout proposal, but also about the condition of childcare in this country amid COVID. CNBC followed up on the Elizabeth Warren story, urging the SBA and Treasury to help keep childcare providers afloat. Nearly half of daycares, they write, preschools and childcare centers around the country were forced to temporarily close during the coronavirus pandemic, and many are struggling to reopen, especially those attempting to get back on their feet without any federal or state or financial support. That's just part of the story there. I think we are getting a couple calls now on this topic, even though our guest isn't here. Beulah, Clarksville, Tennessee, are you on the line?
Yes, I'm here, sir.
Are you calling about childcare?
I'm calling about childcare and maybe comment on other things. But first and foremost, let me thank the TV stations, because if we were back in 1917, we had the last pandemic, we would not be getting the news that we get. So I don't hear very many people give you all, the people in the industry of television, any kind of media success, we would not have access to all this knowledge or information. But back to child care, it is difficult for me to see children going back to daycares, because we know that children don't know anything about social distancing, and that the child care workers would be constantly trying to keep those children apart, and it may not be an economic positive for them, because they would have to limit the number of children that may be in their care otherwise. So I think that we have to give some real consideration for that, because the child care centers don't have the capacity to, limit their class sizes to 10 or 5 children. Okay,
Beulah, thank you very much for calling. We do have Isabel Soto back again. She's with the American Action Forum. Can you hear us now okay?
I can hear you now. Thanks for having me.
Thank you. We did start talking about the issue at least, but wanted to get your sense. You're an analyst at the American Action Forum, of what the condition of childcare here in the U.S. was before COVID-19 hit, and how would you describe it today?
All right, so before COVID-19, we already had a child care capacity problem. There weren't enough centers, there were too many children, conditions were not good, and the quality was just not up to par. So coming into the pandemic, we were seeing a system that was already broken only exacerbated by this problem. So where we stand today is post a whole bunch of state shutdowns that limited capacity, led to 30% of child care workers being laid off. And now that we're in a stage where we're trying to regain some of the economic gains we've had over the last year, get people back to work, parents are going to struggle to be able to find affordable and available child care as they look to return to work.
Put the phone numbers on the bottom of the screen again for our guest, Isabel Soto. Parents, call 202-748-8000. That's your number. Employers want to hear from you, 202-748-8001. Everybody else, 202-748-8002. Our guest is Isabel Soto with the American Action Forum. Explain what the American Action Forum is, what its mission is, how it's funded.
Repeat the question?
Your organization, American Action Forum. Tell us about it.
Oh, the American Action Forum. We're a center-right think tank. We focus on rapid response policy pieces to inform the public as well as policymakers on the Hill. In terms of funding, because I think I heard you ask a question on funding. I don't know a lot about that. We're a 501c3. That has nothing to do with the work that I do. I stand by everything that I write.
Let's hear from Rashid Malik, who is a senior policy analyst for early childhood policy at the Center for American Progress. Testified at a hearing this past week on childcare and COVID-19. He addressed the impact of COVID-19 on childcare facilities. We'll take a look and then come back to talk more.
1/3 of the childcare workforce lost their jobs in April, and those jobs may not come back without a public investment. Revenues have been decimated due to lower enrollment, while operating costs associated with reopening have increased dramatically. Without new federal funds to support the physical infrastructure of childcare facilities, we should expect diminished childcare supply, which could inhibit our economic recovery. And to this point, the Center for American Progress just yesterday published an open letter to policymakers signed by 100 prominent economists who stated that, quote, an effective government response to the childcare crisis will play a vital role in the reopening of workplaces. My sincere concern is that without major immediate and ongoing investments in our childcare infrastructure, we could very well lose as much as half of our country's childcare capacity. Ultimately, we could be left with a childcare system that is only accessible for the privileged, limiting access for children for whom the benefits of childcare are the greatest. We risk economically disastrous outcomes as women take on more and more unpaid childcare duties and put their careers on hold or reduce their hours worked.
So Isabel Soto, he's saying that childcare will be greatly reduced, available to only few, and lots of economic fallout from all this. What's your take on all this?
I think that's absolutely right. The concern is that a lack of childcare is going to make it much harder for people to return to work. So as much as we would like to see like a V-shaped economic recovery, we're looking at about 30 million parents who might face this challenge and not be able to go straight back to work because of these childcare concerns. The other thing I heard was, we need some sort of support. This is an ongoing problem. It's not new. A lot of people have tried to find solutions, and the pandemic is really just highlighting that something needs to be done. Now the question is, what should be done? So the federal government has already given aid through the CARES Act, has provided options through the Families First Coronavirus Response Act. So in my opinion, when it comes to policy, we need to be very cautious. While we are in a crisis of public health, as well as this child care and returning to work crisis, we need to make sure that the policy we put forward doesn't make things worse long term.
You mentioned what government can do. We've touched a little bit on the bailout proposal by Senators Warren and Smith, $50 billion. We can put back on the screen the main provisions. Tell us more about what you know about this particular proposal, and is it generating a lot of dialogue in the Hill? Does it have a chance of passing?
So this is one proposal of many there are a lot of different proposals like this to just increase funding by the millions, by the billions. We've already done some of this, I mentioned through the CARES Act, by allocating $3.5 billion to stabilize childcare through a block grant. So this is one option, is to put more federal money into childcare. My concern with the specific bailout option, as well as others that are similar, is that this is a Band-Aid. It's a temporary solution. This is not going to mean long-term stability for childcare. What it's going to mean is continued government funds that go into childcare, and the government is going to start to be in charge of raising children, and it becomes a logistical nightmare, and aren't really quality control measures on these kinds of things. Furthermore, it could have the risk of pushing out civic society options, so things like informal care. Why would you call your trusted neighbor, your friend, your family member to take care of your child if there's a free government program? So my concern is not only does it mean more spending, more money being spent by the taxpayer, but also weakening important social bonds and informal child care networks.
A lot of the talk in this country, Isabel Soto, at least in recent weeks, has been businesses reopening, parents considering going back to work, at least in parts of the country. What do you see childcare looking like in this country post-COVID? What does the physical structure look like? How do these childcare facilities move on and create a business that can be run and provide this service for folks?
Mm-hmm. So I think the first thing to know is that there are a couple different ways that you can choose to do childcare. I think the one that people typically think of is a private, formalized center where you take your child and you drop them off, and there are a number of other children there. The other thing to consider are these home-based centers. They're a lot more informal, they're a lot more localized, they're actually at someone's house. And then there's informal care and the informal networks. So we have this whole patchwork of options available to parents. But during COVID, what's really been affected has been those private care centers. And that's mainly where we're seeing a lot of the closures. Those home-based, more localized centers have actually seen a decline about since 2005, the number of those started to decline. And then on the informal side, there's this public health concern as well. So you can't have, drop the kids off at the grandparents' place because of concerns around the virus. So what we're seeing is extremely limited capacity and fewer options for parents, forcing them to either choose between going back to work and supporting their family or staying home with their children. So it's a very, very serious problem that we're dealing with right now.
And what's your take on the role and responsibilities of employers themselves in a situation like this? Somebody who wants to go back into the office and just needs that help. What would you say about employers in this country?
So on the employer side, that's also difficult because you have small businesses that have been struggling, have been hit very, very hard, and may not be in a position to be able to offer additional support for parents. In certain industries, it might not be possible to offer some of the flexibility that parents need. That being said, we've seen this huge movement building over the last couple of years of paid family leave, and included in that is paid leave for childcare. And a lot of companies in the private sector have started to follow up on that and give options, make a more flexible work schedule. And that's going to be something really interesting to look at moving forward, especially considering that now the people that do have jobs, a lot of them are working remotely and have been able to do so relatively successfully. So it's going to be interesting looking at what the private sector does in response to this childcare problem, because they certainly don't want to lose employees that they've invested in and they've trained. So they might choose to make work schedules more flexible. They might choose to offer things like paid leave.
remind folks of the numbers to call in. If you're a parent, call 202-748-8000. Employers, 202-748-8000. One is your number. All others, 202-748-8002. I think we have a call now. Sergio, Pompano Beach, Florida. Thank you for waiting. Go ahead, please.
Yes. Good morning, Paul. How are you?
Doing fine, sir. How are you?
I'm doing very well, sir. Good morning, Isabel. How are you?
I'm doing well. How are you? Thanks for calling.
I'm doing very well. It's an honor. My question is to you. Basically, is this: how would your organization help, especially when our child do get sick or and whatnot? How can y'all help these children who are infected or into improving their health and so forth, and parents that want to go back to work? How can you help that situation?
Thanks, Sergio.
Mm-hmm. Yeah, thanks for the question. So my organization doesn't directly deal with childcare, but you bring up a really interesting point on, with the coronavirus, we still don't quite know what we're dealing with. We've seen cases of children with the virus. It does seem to affect older populations more, but this is another element to this balancing act of work, childcare, and then, this public safety problem. The other question is, even if we somehow are able to go back to full supply, can parents feel comfortable, and will they feel comfortable bringing their children into a center where there are other children who have been potentially exposed to adults, or maybe are carrying the coronavirus, and bring that home with them again? So that's a really important point with children that are sick. The other side of that is this paid leave question. You can take up to about 12 weeks under the new legislation, under the second coronavirus package, to either take care of a child or take care of a sick family member. So that is a short-term option that you can take as an individual or as a worker.
Let's go to Boise, Idaho for Fred. You're on with Isabel Soto of American Action Forum. Hello, Fred.
Hello. My thought is, it can't possibly hurt to pray for these people that have the virus and their families. It can't possibly hurt at all.
Caller, anything about daycare itself and the future of that service in this country amid COVID?
I don't have any children, but I think it is there. But I'll tell you what, right now, the people, they need to get help because the cost of daycare is skyrocketed.
Thanks for calling, Fred. Isabel Soto, speaking of costs, would you expect costs to rise even further when services are back in place amid the pandemic?
Yeah, another really important point is the cost side. We've already seen the child care cost rising and rising even over the last 40 years. It's been rising faster than just about any other consumer good. So with the pandemic, what we're seeing is a lot of regulation. And regulations and implementing them and following them costs a lot of money. So ideally, in a child care situation, you want to make sure that the child care workers have masks, the children are washing their hands, workers are washing their hands. And so costs are significantly going to rise, not just because of that, but now child care centers in a lot of states are limiting the actual classroom size to 10 children. So that's going to mean less money coming in than what these centers would expect, which would mean a rise in costs. So that's the other side of the coin, is costs are rising, but workers are seeing lost wages due to layoffs, furloughs, as well as cut hours.
Let's hear from Ben. Ben is in Reston, Virginia. Go ahead, Ben.
Hi, good morning.
Good morning.
My comment is about, the problem with dealing with the kids. It's going to be ongoing, and I know school teachers who are, ready to pull their hair out of their heads. I think what they need to do, they're going to have partial classrooms, but still they're going to have to warehouse the kids. So they could leave them in the school and into the gym, library, and cafeteria, and just modify the air handlers so that they're not breathing each other's air, and take them into class. And, they're just going to have to reschedule. But the building, I think, the facilities are functional, intact. They're just going to have to redo the air handler system so the kids aren't breathing each other's, air. I don't know what other possibilities there are.
All right, Ben, thanks. Let's get a response from our guest. More about the sort of the physical structure of what a daycare center or daycare facility might look like in the future following COVID.
Yeah, so the other element outside of just the formalized care are schools. Some states have said that, they're definitely going to be reopened for the fall. College campuses are seeing how to deal with that and remote learning. So we're in a completely different space than what we've ever seen, that we're probably going to have to restructure, not just childcare centers, but what Ben was saying, schools. So a lot of schools not only are experimenting with remote learning, but just working on how shared space is going to be utilized. There's talk of sectioning off the playground, basically having children go in shifts to the playground. So this is going to look very different, from limited class size to rotating schedules. I believe it's in Louisiana that you can't even bring in a reusable lunchbox, so brown bag lunches are going to come back, all in the effort of just containing the spread of the virus and making sure that this reopening doesn't cause a huge spike in cases.
Let's go to Robert, who is in California, Panorama City, California. Hello, Robert. You with us?
Hello, I am. Thank you very much.
Welcome.
Isabel, I hope you're well. I just wanted to comment that things have changed over time here as I've grown up. And I wanted to say that as time has changed, it is much more important now for families to be able to afford to live. And in that respect, two people need to work to afford to live in our society, which has been created by people that I feel you are. In that respect, you must allow for the fact that they need childcare, or we, as a people, will cease to exist. All there will be will run out of people to survive or continue with life. So taking away child care or disparaging child care for families that need it in order to survive is not a way forward. It's a
Robert, thanks for calling. Let's hear from our guest, Isabel Soto.
Yeah, and I think that's a good point. Is for some people, this isn't even just it's not just an inconvenience of I have my child at home, it's difficult for me to focus, or I need to go to work. This is really going to affect specifically low-wage workers who have to get back to work as soon as possible just because of their financial and economic situation. So this problem, while it's affecting everyone, we need to keep in mind, as a caller said, a lot of people, this is a lot more about survival and being able to be self-sufficient and being able to take care of your family. And just a quick note on who this is actually affecting, we also want to keep in mind that this is going to disproportionately affect women, especially single-parent households run by a mother. Today we saw women taking care of the majority of child care needs. So we want to make sure that we can support those people and be able to safely get back to work, safely get back to some form of child care as well.
Silas calling from Rutland, Vermont. Welcome to the program, Silas.
Hello. Thank you for taking my call.
Sure.
I have a relative who was in the early childhood development business who actually had an advanced degree in this area and left the industry, left the job to do another path because of the challenges pre-COVID with opioid addicted parents who were neglecting their children at home, and they would show up to daycare centers with very disruptive personalities, almost feral, if you will, because the parents were thinking of the drugs, not the kids all the time. And so this was a challenge already going into the COVID, and then you have COVID on top of the whole situation. So this is, you have very qualified individuals leaving the industry pre-COVID already. And that was just a comment I wanted to make, that is, you throw that into the mix, and it's extremely interesting to see what we can do about all of this going forward. So it's just not one topic that's challenging.
Let's get a response from our guest, Isabel Soto.
Yeah, that is a great point, bringing up the opioid epidemic. It's actually an issue I care a lot about. And with the child care problem, because there are parents that are addicted to drugs, we've seen actually a shift over the last few years to kinship care. So having other relatives, aunts, uncles, or grandparents taking on the role of caretaker, so that they can actually support that child. So you have this added challenge upon challenge dealing with the addiction of a family member, and then having to find childcare to be able to just support the rest of the family and enable those people that are taking on that added responsibility of taking care of a child to be able to go back to work and pay for the child care that they need. So that is a really great point, and thank you for bringing that up.
Our guest has been Isabel Soto, who is a labor market policy data analyst for the American Action Forum. Thanks a lot for your time and your insights this morning. Much appreciated.
Thank you so much.
We will take another short time out. We have 30 minutes left in the Washington Journal, and we're going to talk about something called the Strategic National Stockpile, and as it relates to pandemic response. Our guest will be Daniel Gerstein of the RAND Corporation, plus your calls. Be right back.
Tonight on The Communicators, Oklahoma Republican